right, go ahead.
Okay, so the circle here represents your right ear, and the X represents the hearing in your left ear. Where I put the mark on the graph was the softest sound that you could hear, about 50% of the time that I presented it to you. And then I made the mark on the graph. These two marks right here that have the arrows attached is I had to turn my equipment all the way up to the loudest sound, and you didn't respond to these two really very high pitches. These marks are here with the arrows are when I put the bone device over your head and I went to your inner ear. And they all have arrows, meaning you didn't respond to any of those sounds. Okay. The range of hearing loss is relative to what we consider the normal range of hearing. Anything 20 or above is hearing within the normal range. 20 to 40 is mild, 40 to 60 is moderate, 60 to 75, moderately severe, 75 to 95, severe, and then profound, 95 and above. So if you look at where the marks fall on this graph, in both ears your hearing is very similar, and you have a severe to profound hearing loss across all of the pitches. Questions so far? No? Any questions? This range right here, and you can see that up here on this graph, we call that the speech banana. Because it looks like a banana, but it also is the range of where most of the speech sounds fall within that range. Not all of them are marked on here, but in the middle range is where the consonants are. The vowels are in the low-pitched range, and then the high-pitched consonants are over there in the upper range. This is where you first start hearing. This is where speech falls. Without any amplification, you're not hearing any speech at all in either ear.
My mom was right.
Mm-hmm.
You can be a CDI. Thanks. Thanks, Vanessa.
So based on that, you would qualify as a candidate for hearing aids. So we could amplify if you wanted to try a hearing aid. You could amplify those sounds into a range where you could hear them.
Sure.
Okay. The other test that I did was to see how well you understood words. And on that test, you got about 30% correct in each ear, which means you missed about 70% of the words. So even when I made the words loud enough for you, you had a difficult time understanding the words. But that doesn't mean that you couldn't benefit from a hearing aid, but that's something that you would need to decide whether you want to do. Okay.
Okay.
This is a graph called a tympanogram. Usually I show this before I show this, but this gives us an idea of how your eardrum and your middle ear system are working. So
Okay.
what we like to see is a peak somewhere near this line on the graph, and you can see it comes up and goes back down. It's within this box,
I have one. We're good.
which is the normal range. So anywhere within this box here, that would mean that your eardrum is moving like it normally should. If for some reason it was a flat line, or if this peak was shifted towards the negative side, that means that there's something going on with how your middle ear system is working. Okay, questions about that? One other thing I want to mention is the type of hearing loss that you have. So because you're having difficulty hearing with the headphones and when I put that headband on you, that indicates that you have a hearing loss in your inner ear, and it's called sensorineural, as we discussed earlier. So the tiny little hairs or the nerves are affected, and that means that with that type of hearing loss, sounds aren't loud enough for you, but then sometimes even when they're loud enough, you have difficulty understanding.
Do you have any idea what might have caused it?
It's very difficult to know for sure. I don't see anything in your history that would tell me, except for you said you had a family history of hearing loss. That was more of a later onset. You're younger than that, so I'm not really sure. But your next step, since you haven't had a hearing test before, would be to go see an ear, nose, and throat physician before we can fit you with hearing aids. So I would need to get a medical clearance or permission for you to obtain hearing aids.
Okay.
Okay? All right.
Yay!
That's kind of the long and the short of it.
Wow.
Thank you.
Thank you.
Great job, our little example. My question is, how long does the entire process usually take? From saying like doing the boxed booth room hearing test. I mean, do you do that all in one day? How does that work?
All of this
Right.
and a discussion of hearing aids if the person is a candidate and if we don't have any barriers to preventing us from going forward to talking about it that day. We could do that in an hour and a half, hour and 45 minutes.
Okay.
We usually book both in the same day. Sometimes we'll just do the hearing evaluation and then have the person come back after they get medical clearance if for some reason they need to see a physician first. So part of our job as audiologists is to determine, is there anything medically that needs to be addressed? So there's different types of hearing losses that may need to have medical attention prior to us even making any type of recommendations. You have a question?
Yeah, should somebody go see you first, or should they go see an ear, throat, and ear, nose, and throat
That's a very good.
doctor? Or, because I guess I'm confused, I just didn't know that they had to go get medical clearance before getting a hearing aid.
Okay, so some people will waive that if for some reason, let's say someone comes in and says, you know what, I've been deaf all of my life. I haven't had any trouble with my ears, I just want to get a hearing aid. And if I do a test and I don't see anything that's very concerning medically, I don't see anything in their ear, you know, they've had a pretty straight history, then I would give them the option. If you would like, I can send this to your primary care physician, they can sign off on it, or you can sign a waiver. So adults could sign a waiver of medical clearance. If someone comes in and I said, you know what, you really, let's say they have a difference between their ears, there could be some indications there that maybe they have a tumor that needs to be investigated. So auditory nerve tumors, they're benign, but they can grow on the auditory nerve and cause unilateral or differences between ears that we can see some of those signs on the audiogram. And we say, you know what, you really need to have this investigated. Some people say, you know what, I've worn a hearing aid for years and years and years, but has anybody ever done an MRI to see if there's something growing on your auditory nerve? So that's one possibility only. There's other types of things too that can cause differences between ears, but that's a big one. Someone comes in, they have dizziness, they have unexplained tinnitus in one ear or ringing in the ears in one ear. Those are also signs. If they come in and they have a problem in, my picture's gone, but if it's in the conductive portion of the ear, so if I detect that there's something in the conductive mechanism that could potentially be treated medically before I'd even go down the hearing aid path, I would have them do that first. Maybe there's some surgery that can correct the conductive hearing loss. So it varies quite a bit depending on when people come to see us. We have people that have been wearing hearing aids for years, some people haven't worn a hearing aid at all, a number of different situations.